Hi guys, I'm Dr. Tara Tobias. I want to welcome you all back. If you are just joining us, to get you up to speed, we are going through a series on spasticity after a stroke and how to manage that, how to do a good progression from wheelchair all the way up to standing. How do you progress from sitting, standing to walking? So just to review, you are joining us in the third video. So just to recap, in the first video, we talked about what an extensor pattern is and how to break up that pattern. I showed you a couple of activities of how to go into flexion to get out of that extensor pattern. Great place to start, so please go back and watch that video. This video will make a whole lot more sense if you watch that video first. Then in the second video, we started to work a little bit more active extension. We started to work into a little bit more knee extension while keeping the ankle dorsiflexed, which is really challenging. Usually once you start to extend that knee, the ankle wants to also plantar flex and throw that knee back into hyperextension, and that creates all kinds of problems when you try and actually take a step. So hopefully you spent the last couple of days just working on that mini squat position that I talked about there. And now we're getting to the good stuff. And this is the question that I always get. This is where everyone wants to start. How do I stand? How do I step? How do I walk? No one really wants to focus on that sitting and squatting and that mini squat. No one really wants to work on that. So now we're going to get into a little bit more active movement. Some of you might be a little bit disappointed because we're still not going to walk, but hopefully you will find that this progression, if you look at it all as a whole, you will see how the progression is going, and you can envision, hopefully, how this could impact your walking. So for all of you that feel like your foot is stuck to the ground, or you feel like you have to get way over onto your uninvolved side in order to get the leg through, hopefully you will see how, if you stick to this progression and stick to this plan, how that can affect the big picture walking, which is what I know everyone is really dying to get back. So what we're going to do today is, first I want to introduce a leg corrector strap to you. I love these straps. What the strap is meant to do, once it is on, is we need to find a way to keep the knees together because the foot is trying to plantar flex and supinate when you stand on it, and that supination, or rolling to the outside, actually has a huge impact all the way up the chain, up to your hips and your shoulders. So if we can control the knee, then the rest of the tree, so if you can keep the trunk, the bottom of the tree, planted well, the rest of the tree is going to be straight, or the rest of your body is going to be nice and straight. So if your foot does supinate, what I like to do is actually strap your legs together. It does two things. Hopefully the foot will supinate less, because we're not allowing the leg to go out. So by blocking the knee from going out to the side, the foot can't really get to the outside as easily. And then also what we're doing is, if your foot does supinate, hopefully the strap of keeping your legs together isn't going to affect the rest of the chain, isn't going to go up to your hips and your shoulders. We're hopefully going to prevent a lot of that. So one, the strap helps prevent the foot from supinating by keeping that leg in. Two, by controlling that knee and keeping that knee in, if the foot does supinate, it's less or roll to the outside, it's less likely to affect your hips and your shoulders. That's the second thing that strap does. And then three, everyone has a tendency to throw that leg out to the side when they go to stand up, or a lot of people do. You really throw that leg out to the side and really just rely on your uninvolved leg to help you stand. So what it's really going to do is it's going to not allow you to compensate as much. So strapping the legs together will help to prevent some of the compensations. I will put a link below where I go a little bit more in depth of neuroplasticity and compensations, and how there's positive neuroplasticity and negative neuroplasticity. I highly recommend you read that blog post, because it really helps to explain why I go so slow and why I'm doing the things that I'm doing. So I know a lot of you want me to stop talking and just get to the good stuff. Enough about why we use a strap, but now let's get into a little more of the how-to. I like these pretty straps. I'll put a link below. I've used them before for positioning. I use them in one of my upper extremity videos on keeping the arm position, but they're really, really great. They're a little bit stretchy, which makes them a little bit more tolerable on the skin. They don't put a lot of pressure on the skin, but they're not super stretchy like an A-strap where you're not going to get any control out of them. They've got just enough stretch in them just to prevent you from the strap digging into your skin. And now I show it, you can, with a little bit of time and a little bit of patience, you could put this on with one arm. That's why I'm showing it, just so that you can see that with these D-rings that are on it, that you can put it on with one arm. It's gonna take a while, so it's a little bit easier if you have someone that can just help you put these straps on. All right, and so now you have the straps on, your legs are strapped together, so your position is gonna be perfect. You could add that wedge that I've used in the other two videos, and you could stick that under your foot if your foot's really supinating. I really like the lower strap for this one. If you really supinate, if you put it down close to the ankles, that will really help to prevent some of that supination. So please, 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 I put these videos out there because I get so many messages. People are just craving things to do on their own because either their insurance has run out or they can't get physical therapy anymore. I love being able to help. I use my judgment of things that I think you could do on your own. But if you do not feel safe, or you try and go and stand up with your legs strapped together like this and you feel off balance, please, please, please do not do the activity or try and get someone to help you the first couple of times just to stand next to you. Please be safe when you do these. So if you're safe and you use good judgment and work within your limitations, these can really be helpful. I just don't want anyone to get hurt. So the first exercise, you're just gonna do a sit to stand. Legs strapped together, so it's giving you even weight bearing on both feet. And you could do this one activity. I know I've said it for every activity. You could stay on this one activity for 2 weeks, but you really, really could. And the longer you stay on this activity, the less likely you're gonna be to compensate. And when you compensate, you're shifting all your weight over to your uninvolved leg, which just is contributing to the supination. I'm not gonna really go in depth with that, but it really does contribute to the supination. If you don't get your weight directly over the foot, you're not getting pressure down on the inside of the foot. The pressure is going to the outside of the foot, and that's just gonna make you supinate more. So stick with this activity as long as you need to. Once you feel like you can do that sit to stand really well, you're keeping your weight balanced in between your 2 feet. Now you can try and do kind of what I did in the last video. It's pretty much the same progression. Now you're just taller. So you're a little bit more extended. Your hips are a little bit more extended. Your knees are a little bit more extended. So we're working more towards a normal upright position, but we're still staying a little bit flexed, and we're paying really close attention that the knee doesn't pop back. So once you do that, start that little weight shift and that little heel lift. Do that little weight shift and heel lift. Weight shift and heel lift, just like I've done in a lot of the other videos. And then when you get good at that, or you feel like you've mastered that, you do a little weight shift and you do a little step forward and back, a little step forward and back. Now you can see the strap is really gonna stop that leg from rotating out to the side, which is really, really common. So use the strap. There's a little bit of stretch in the strap, so you can take a little tiny step forward, but you're not gonna be able to step very big. Now here, I've taken the table out of the way and I've just shown it to you from the front. I do highly, highly recommend that you try and keep both hands on the counter, because then you're getting a little bit of weight bearing through your arm as well. But I wanted you to see what it looks like from the front. The weight shift, so I'm staying nice and vertical. My hips not going out to the side, my shoulders aren't dropping. I'm really moving as one unit over to that involved leg. And then with that wedge underneath there, it's really helpful to, when I move over, that the foot's not gonna supinate and go out to the side. So just another way to show it. Here's actually a little bit of a closer look at the feet and what the feet are doing. And again, you could stay on this activity all day long. So once you've mastered that, and you feel like you can take that little tiny forward backward step and your foot is not going to supinate, go ahead and just stand in a staggered position. So now what we're going to do is like a progression towards like a single leg squat almost. So you're just going to sit back over your involved leg, and then you're gonna stand up. So now we're working a little bit more dynamic movements. We're working a little bit active extension without going into that spastic pattern. So this requires motor control. A spastic pattern going into extension isn't really control. That's really an involuntary movement. So by doing that little mini squat and then coming back up to standing, you're really working controlled extension at the knee, and still we're maintaining a pretty good dorsiflexion in the ankle, which is really an important piece to this activity. The other thing that I love in this position to do, in this staggered position, is just a forward backward weight shift. One thing that a lot of people do is they don't have the hip control to get their body forward. When they're standing on their involved leg, they don't actually extend their hip. So their hip stays back and then they just kind of lurch their body forward. So working that forward weight shift in this staggered position, really working on that hip extension, is invaluable when you actually put it all together and start walking. And so now once you've done all that with the strap on and you feel like you're getting really good at keeping that knee in, the knee's not going out to the side, the hip's not rotating out, now you can go ahead and take that strap off and pretty much go through the same progression now without the strap, trying to keep that knee in close, not letting it go out to the side, because usually when the knee goes out to the side, the foot's going to supinate, or vice versa. You're going to supinate and then the knee's going to go out to the side, and it's just going to throw everything off and make walking and standing really, really difficult. So take that strap off, go back to the weight shift, lifting the heel and then the weight shift onto the leg, stepping forward. And then you could do that stagger stance again and do that forward backward weight shift. So same progression, just without the strap this time. And then we're gonna take it one step further. And again, please be safe and please use your judgment on this activity. But now we're going to actually shift all your weight onto your involved side. And then you're actually going to set your uninvolved leg on a block and just hold it. This is really, really advanced. Don't do it if your foot supinates, rolls out to the side, or your knee goes out to the side, because then you're not getting the benefit of these standing activities. So if that happens, no problem. No, there's nothing wrong with going back to the previous progression. Now, since we're talking about progression, just for clarification purposes, every video I make, it's not intended to replace therapy. I saw a need for people to be able to enhance their physical therapy program. I am not saying by any means that you don't walk. I just think that walking needs to be with a physical therapist who can cue you. So I don't work on these things that I'm showing you during a therapy session. I come up with things that are safe for someone to do on their own and that they can do good quality movement on their own. And then in therapy, I can really focus on the things that require more cueing. So in therapy, we do spend a lot of time walking, stepping, higher level stuff. We can go a little bit more challenging because I can control the movement. And again, remember, it's all about that neuroplasticity. What you practice is what you're gonna end up learning. In therapy, I can challenge you a little bit more and we can work on that walking. I'm not saying that you should not be walking. I'm saying that the activities that you spend the most time on should be the things that you can successfully do with good quality movement for that brain to reorganize. So I hope that clears the air for some of the questions that I'm getting. And if you have any comments about that or that doesn't make sense to you, just let me know in the comments and I'd be happy to try and explain that a little bit more. And then the other thing is, where do I go from here? There's one more step that would be a very quick video of one more standing progression that we could do from here, but I'm getting a lot of comments of people that want stuff for subluxation and for the arm. So just let me know. You guys have done really good with the likes. That's why I keep going with this standing progression. you guys are liking these videos, so that means that you want more. But if you wouldn't mind, in the comments below, if you want me to make one more video showing a final progression of weight shifting that you could do on your own, put hashtag stroke gate. And if you want me to move on, still like the video, because I want to know if these stroke videos are going in the right direction. But if you want me to move on to the upper extremity and you don't want me to do one more progression, you would prefer me to go on, put hashtag stroke arm. So if you want me to do one more gait video, hashtag stroke gait. And if you want me to move on and start showing you some activities for a spastic arm, put hashtag stroke arm. And that will help me to decide which direction I go for the next video, whether I start a new series or whether I do one more in this series. And that is it. Those are all the exercises that I am going to show in this progression. I hope you're finding them helpful. Just another little side note, I know you guys are sick of me talking. I could not express enough how much I love what I do. And I love talking about what I do. And I get excited when I talk about what I do. And I get excited when I have patients that can do something new today that they couldn't do yesterday. And now, thanks to all you guys, I get to talk about it, and it doesn't just fall on deaf ears, but there's all of you that allow me to do this and allow me to talk and allow me to get excited and be nerdy about something that a lot of other people just don't really care to hear about. So I am so grateful and I'm so appreciative. As usual, if you liked this video and you like stroke walking videos, like this video. This is, you know, if I go to the arm, but I come back and I see that this series had a ton of likes, then I'll do more exercises. I'm constantly coming up with new ways to have my patients do things at home on their own, so I never run out of ideas. So definitely like it. If you haven't subscribed yet, please hit that subscribe button so that you'll be one of the first to know when I post a new video. And again, have fun with this activity. Be patient with yourself. Have a little grace with yourself. Celebrate your little victories. Don't give up. Keep setting goals for yourself. Keep challenging yourself. Leave comments so that we can interact throughout the week. As always, have a great night, and I'll see you in the next video.